So one of the main applications for MEG technology today is in the field of epilepsy. So in epilepsy, you've got some dysfunctional neural tissue that effectively creates what can be considered a short circuit in your brain. And again, because we know our technology basically identifies the magnetic signature that results from bioelectric impulse between neural tissue or neurons, we're able to detect where that, if you will, short circuit occurs within the brain, and we can localize that. So pre-surgery, helping identify with greater precision where you want to focus in resolving that dysfunctional tissue is just such a huge value. And we know when you're going into a surgery that involves, opening up the skull, you want as much diagnostic capability and as many tools as you can available to you beforehand. And it's where MEG provides such a great value. One of the areas that we're really excited about is the field of radiation therapy. The current standard is to use CT and MRI technology to identify where in the brain a tumor resides. And then through technologies, whether it be standard radiation therapy or proton therapy, you target that tumor in a way to minimize, non-diseased tissue to the extent that you can. What we're now looking at doing and excited about is that we can actually start to utilize MEG technology so that we can identify not just where the diseased tissue is, but where those functional areas of the brain are located. For example, auditory and visual and memory type of areas where we can actually map around and spare those functional critical areas. So we're really excited about the opportunity to not only anatomically target and eliminate the tumor, but to do so in a way that spares cognitive function to the extent possible. Really excited about it in the application of radiation therapy in pediatric brain tumors, where we're really looking to make a difference. So in terms of diseases such as dementia, Alzheimer's, with MEG's resolution and its diagnostic capability, we see a really huge growth in those fields so that we can help identify or more readily identify those research applications, new pharma products, new biological products, help map out the impact that they're having at a much earlier stage and in a much more sophisticated manner. So as the healthcare field dives more into these new, relatively new diseases, we see a much bigger role for MEG going forward as a supplemental tool to MRI, CT, and PET.